Hello everyone. In this video I am going to explain about one of the complaint of pregnant women before delivery, that is false labor pains. Here I am discussing about definition, cause of false labor pains and differences between false and true labor pains. And don't miss till the end of this video. At last I am going to explain about homeopathic management with homeopathic remedies, and keep watching these videos. Next I will come with one more complaints of the antenatal care and its homeopathic management. So, what is antenatal care? It is a systematic supervision of a woman during pregnancy is called antenatal care. And what are the meaning definition of false labor pain? False labor pains are the contractions which occur at irregular and unpredictable intervals, and the woman feels pain and discomfort in the abdomen. And these are the labor pains more commonly seen in the preemie than the multiparous woman. And these pains usually appears prior to the onset of the true labor pains, 1 to 2 weeks before in the preemie, whereas in the multiparous few days before the true labor pains. What are the causes? Causes may be unknown, but a combination of fetal, placental, and maternal factors influences that false labor pains. And due to stretching of cervix and lower uterine segment, and irritation of neighboring ganglia also may cause the false labor pains. And how will you differentiate true and false labor pains? The false labor pains, these are irregular and do not get close together, whereas true labor pains are regular intervals and as time goes on get closer together. And the contractions of the false labor pains may stop when the patient walks or takes rest, or may even stop with the change of the position. Whereas true labor pains, they are continued contractions despite of the movement or change in position. And these false labor pains usually weak and do not get much stronger, whereas true labor pains increase in strength steadily and progressively. And these false labor pains are very dull in nature and are confined to lower abdomen and groin region, whereas true labor pains felt in front of the abdomen and radiate towards the thighs. And false labor pains usually relieved by giving the enema, whereas true labor pains not relieved by any medication, and it marks that onset of the labor. And false labor pains usually associated with symptoms of the gastric upset, but true labor pains not associate no symptoms, no associated symptoms of the gastric upset can be seen. And what are the homeopathic remedies for this false labor pains? Calophyllum is indicated where there is severe pains fly in all directions without progress. And this calophyllum corrects deranged vitality and produces efficient pains if the symptoms are agree. And next, calicar, where pains are sharp, cutting, and across the lines, and this pains stitching and shooting, and violent back pain wants that back pressed. Whereas Naxovamica, false labor pains extended to the rectum and frequent desire for stool and urination. And Naxovamica person is very irritable and cannot bear to be touched. Next is the pulsatilla, where pains rapidly shifting accompanied with constant chilliness, and pains are associated with suffocative and fainting spells, bearing down sensation, and then these worse on by lying down. Actio one more remedy, where sharp pains across the abdomen and sleeplessness, severe spasmodic pains at least by the least noise, and when given during last months of pregnancy it shortens the labor. Belladonna, one more remedy. Key symptoms are false labor pains come and go suddenly and pains usually in short attacks causes redness of the face and eyes. And next, chamomilla keynote symptoms for prescribing are pains, spasmodic, distressing, tearing, extending down the legs, pains pressing upwards, dragging pain towards the uterus, like labor pains, and frequent urging to urination. So these are the few homeopathic remedies can for giving this false labor pain. So before that giving, we should differentiate from false labor pain to true labor pains, then we can give the homeopathic remedies. So thanks for watching. But at last I want to tell that homeopathy is safe for women to use during pregnancy and even postnatally, including during breastfeeding. It is a gentle yet effective system of medicine, and the remedies are highly diluted and are not chemical drugs, so they cannot harm the baby. So this, thanks for listening.